Dr. Mecerdes Ebanks. I am co-founder and CFO of the Mecca Group, and there I also serve as a behavior therapist, parent coordinator, and bilingual evaluator. Today, I would like to discuss the effects of the pandemic, especially regarding children and parents, as well as to discuss anxiety and depression and forms of treatment. The pandemic caused a huge increase in anxiety and depression in school-aged children, as well as college-aged students. There was an increase in cyberbullying as a result of more time for children to be on social media. The influences of the negative influences of exposure to certain imagery on social media also caused effects of lower self-esteem. There has been effects of isolation that children have been feeling as a result of not being able to socialize with their friends, feeling as even an outcast within their own family, a lot of alone time, or for some who wanted some privacy but did not have it in their homes. There was a lot of disruption in their normal routines, not being able to attend sporting events or play in sporting events. There was a lack of physical exercise, which then affected for some children, their weight, their level of stamina. There had interruptions in their sleep, also caused some difficulty with concentration and focus. They had a lot of children experience having learning difficulty as a result of perhaps limited access to technology and Wi-Fi services, children that were already experiencing difficulty in certain subjects felt withdrawn and not being able to grasp the concepts. And then parents, as a result of this, seeing their children experience this, parents, in addition, were feeling emotionally exhausted. They felt burnt out as a result of having to multitask more than usual. They had levels of feeling of being out of control and not having uncertainty due to what would happen next, how to keep their family safe, where perhaps even their next meal was coming from due to food shortages, being unemployed, knowing when monies was even going to be come in. There was levels of frustration in relationships. Perhaps the families were already having difficulty within their marriages or having to care for others in their home, perhaps their parents or elders. There was the lack of having to understand or balance work and life, because people were working remotely, that it really became all in one. So knowing how to separate it. There was a feeling of helplessness, as well as for many financial concerns. And as a result of this, there were many that were feeling the symptoms of anxiety and depression, something that they perhaps had not felt before, and now did not know what this meant. And unfortunately for many, they did not realize that they were having experiences of depression and anxiety. They masked not being able to sleep and kind of chalked it up to, oh, it's, because, sleeping with the television on, or they would take melatonin to kind of mask what was really going on, or having feelings of weight gain or experiencing weight gain more to just being in the home, but not understanding those are symptoms of depression. Having difficulty concentrating, that's certainly a symptom of depression. And many of, of individuals were having feelings of depression along with feelings of anxiety, feelings of fatigue and restlessness, irritability, but not, again, understanding what that meant. And therefore, it is very important that individuals seek professional assistance to properly diagnose the disorder. Many people would self-diagnose and also self-medicate without really getting the proper assistance. And that's why it's, it's such as this panel and this symposium discussing mental health is so important, because of the fact that there needs to be more open conversations about the need to seek services, and receive the proper treatment. So typically a proper treatment would be to get a formal assessment conducted by a psychologist or a counselor that consists of a clinical or psychological evaluation, interviews, and also to track the history of how long an individual has been experiencing some of those symptoms. Treatment may involve medication, but it's not just using one form of treatment. It's typically most effective when there's a combination of treatment, medication monitoring along with therapy. And therapy also can come in so many different forms. There also is a consideration for holistic treatments, such as exercise and looking at your nutrition and your food intake. Those are all part of a healthy treatment plan. And there's also other recommendations, such as journaling your thoughts, limiting disruptions before sleep, removing the phone from your immediate access so you're not checking the news or the statistics right before going to bed. Trying to maintain a routine, but also understanding that you have to be flexible with that. Also, being involved in group activities. Because of the pandemic, many people felt isolated. So being involved in group chats or group meetups virtually has been seen to be effective. Also to stay solution focused, but also understand that you may not have total control, but having a plan and having a goal is important to maintain that. Also allow yourself time to grieve. Many people have lost loved ones, have lost employments, have lost relationships, have lost a sense of self. And it's important to allow yourself to grieve and allow yourself some grace to be able to understand that this is something that a person can overcome. Also, to have moments of self-affirmations, to read positive comments, to say positive things about yourself. Also, evaluate your food intake. What is in what you're eating, to see whether or not that may be contributing to either weight loss, weight gain, and also making sure that you're staying on a regular schedule so that you don't have weight loss. Finding forms of exercise. They could be simply walking. Many people indicated that they had a sense of not getting up and going to work, but still getting up and getting dressed. And even if you're walking out the house, to walk around the block if you could, and then to come back. Finding a hobby, enjoying time to yourself or with your loved ones. I am part of the Mecca group, as I stated, and we have started Mecca Moments. Mecca Moments is a bi-monthly segment that we host on our YouTube and our Facebook Live, and we have addressed many aspects of mental health, emotional wellness during the pandemic and for life thereafter. We've discussed segments on relationships, on children, on suicide, on financial wellness, and we will continue to host bi-monthly segments on our Facebook channel, as well as we will be hosting a podcast coming soon. So we are a psychological service agency based in DC. We provide mental health services, career opportunities, career counseling, as well as consultation and assessments. Thank you.